Hi, everybody. This is Lee, and talking about that healthcare plan, the AHCA. It's been getting a lot of press, not a lot of it good. People have concerns. I'm looking at an article at the Black Agenda Report. It's a radio commentary by Glenn Ford, and he's saying that people should not expect the Democrats to wage an honest fight for the people's health care interests either, meaning besides the Republicans. The Republican plan to replace Obamacare is, as expected, an unmitigated disaster. While Obamacare was festering in its own contradictions, the Republican replacement will likely result in 10 million more uninsured Americans and total chaos at every level of healthcare infrastructure, resulting in an almost instantaneous social and medical crisis, and not just for poor people. And so Glenn Ford is saying that there is a cynical jockeying for position over this healthcare crisis, that rather than addressing the actual downsides of the AHCA, that the Democratic Party is using it as sort of a game or one-upmanship, trying to position themselves for electoral success in 2018 and 2020, which is likely why some people you would think would co-sponsor and endorse HR 676, John Conyers' Medicare for All Expanded Coverage Act, that they're ignoring it, not providing any solutions, laying in the cut, waiting for the Republican Party to implode underneath the weight of their own flawed product. But the problem is that in the meantime, people will lose their coverage or continue to be uninsured and likely suffer as a result, either worsening of their medical conditions or death. That there is speculation that each year that we have inadequate health care, that 45,000 people die. And so while the Democratic Party is playing these games, people are dying. And before we come to a Medicare for all solution, more will die. And they're willing to allow that to happen if it means that they can get elected and ride the benefits of the Republican Party's failures. And so I'm going to talk real briefly about HR 676. This is John Conyers' Expanded and Improved Medicare for All Act. He submitted it to the House several times already. Fortunately, I've been checking the number of co-sponsors, which has gone up since the last time I checked, and I think it was inspired by the release of the AHCA, the Republican health care plan, that inspired more members of the House to co-sponsor this bill. They're up to 65. And so it started out with 51 co-sponsors, like immediately after it was introduced. So little by little, people are catching on. But there needs to be more. I've already said, I'm wondering where Tulsi Gabbard is, but, maybe that's all part of the game too. Let's see. And so there's also an article at Common Dreams. Even without a CBO score, the Republican healthcare plan gets bad marks. And so the CBO, Congressional Budget Office, has not yet analyzed or released its analysis of the healthcare proposal, but that there have been other analysis of the proposal, and not good. A report from Center for Health Policy, the Brookings Institute, and the University of Southern California's Schaefer Center on Health Policy and Economics. Um, they're saying that the CBO will likely estimate that at least 15 million people will lose coverage under the AHCA by the end of the 10-year scoring window. Estimates could be higher, but it's unlikely that they'll be significantly lower. And so, specifically, let's see, there was a survey, and it's reporting from the survey that the Republican plan offers less assistance to older and lower income Americans, especially in rural areas, according to the Kaiser data. These groups generally backed Mr. Trump, and it says Mr. Trump, but it should be saying President Trump. Most of all, President Trump's white working class supporters often make enough money to be ineligible for Medicaid, but not enough to afford costly health insurance that might even become more expensive under the Republican plan. The plan would hit older and rural Americans hardest because it wouldn't provide a larger tax credit to people with more expensive plans. Older Americans pay the highest premiums, and the law would allow insurers to raise premiums for older customers even further. And so there's more information in the article discussing the plan. This is an article at Politico. Budget referee may call foul on Obamacare repeal. And that's just more information on what the Congressional Budget Office Director, Keith Hall, may come up with after he does his number crunching, and that people anticipate that the news won't be good. And there's an effort to politicize the issue by Donald Trump's press secretary, Sean Spicer, who is actively downplaying the analysis ability or capability of the budget office to score accurately. And so it's basically a political football, but we'll see what the number crunchers come up with, the actuaries surrounding the AHCA. I described it as a clown show, but hopefully, there'll be more of a focus on Medicare for all. I do believe that that is the best solution. That people are so partisan about whether to use Trump care or Obamacare that they've just both become so almost radioactive, both of them, that possibly only a new product that's not been tried before would be acceptable to all, populations. And I think that's the Medicare for all solution. Right now, it's happening state by state. We've got certain states like California, Hawaii, considering these solutions. Colorado tried it, but more states may try. It might just go the way of the legalization of marijuana, like state by state by state, until we get a clear majority, and then it becomes national law, hopefully, and we get a good health care plan for everyone. So we'll see how it plays out. In the meantime, watch for the Congressional Budget Office score on the AHCA. Good luck.